We've told you that February is Heart Health Month.
But your own heart isn't the only one you should be concerned with.
That's right. It's important for your pets as well. And this morning, we're taking you inside an animal hospital where one dog is getting checked out right now.
Joel Nichols live at Blue Pearl in Overland Park with more. Good morning. You and Scruffy over there. I love it.
Scruffy is just the greatest dog, so calm, easygoing, and right now Scruffy is undergoing the scan that Dr. Laura Hutton mentioned earlier. Let's talk a little bit about what you're doing as you're doing it.
Sure. So we're just essentially taking a look at Scruffy's heart. We're looking at all the blood flow in his heart, how his heart is functioning, and we're able to detect any underlying heart disease if it's there and then figure out how to best treat it. In Scruffy's case, he's a good boy, doesn't have any heart disease right now, which is great.
And Scruffy is 8 years old. And look at this. This is so fascinating, the way this table is set up. You actually have that that opening right there, and Scruffy is pretty easygoing anyway. But I bet for a dog where this is all kind of new and different, that makes it a little easier.
It does, yeah. And most dogs are at ease on this table. It's nice and padded, completely non-invasive test. We just dampen the chest with a little bit of alcohol and put a little bit of ultrasound gel on there. And a lot of times they end up falling asleep during the scan. So as you can see, Scruffy's pretty laid back and feeling pretty good right now.
Scruffy's very at ease. Now, as we talked about earlier, you can have a young dog with a congenital heart situation. That might require some sort of surgical kind of intrusion. But as far as an older dog, oftentimes they might develop a heart issue. That can often be treated with medicine, but the way to find that out is to kind of do what we're doing with Scruffy here. What else should we kind of watch for and listen for with our dogs as they get older?
So if they're slowing down with exercise, if they're slowing down on walks, that can be a sign of heart disease. It can also happen in dogs as they age too. But if you have a dog that's coughing a lot, if they're having more labored breathing, if they're starting to faint with activity or exercise, or if their abdomens are starting to become more swollen or distended, that's definitely something to get checked out.
But look at Scruffy. You could not have a better patient than this little dog right here. Just so calm, laid back, like, hey, this is just fine. I'm just getting checked out by the doctor. Everything looks good. So do that any time of the year. We're talking about it in February because it's Heart Month, but any time of the year you should make sure your pets are getting their exams and keep an eye on them if they quit eating, if they change their behavior a little bit, things like that. And then come and see the doctor and find out what's going on like they do here at Blue Pearl every single day. Scruffy, you're a star. And you're totally unimpressed with television. Good for you, buddy. Back to you.
Oh, you're a good boy.
So calm.
You too, Scruffy.
Thank you, Joel. Good information.